What are the long-term effects of using nicotine replacement therapy? Have you ever wondered what happens when someone uses nicotine replacement therapy for an extended period? This therapy is designed to help people quit smoking by providing controlled doses of nicotine without the harmful substances found in cigarettes. While it can be a helpful tool, understanding the long-term effects is essential for anyone considering this path. Long-term use of nicotine replacement therapy means using it beyond the recommended time frame. Research shows that this approach is much safer than continuing to smoke. Unlike cigarettes, nicotine replacement therapy products do not contain the harmful chemicals that lead to most smoking-related diseases. This means that long-term users are exposed to fewer toxins compared to those who continue smoking. One of the most reassuring findings is that long-term nicotine replacement therapy does not increase the risk of cancer. Nicotine itself is addictive, but studies have not shown it to cause cancer. So, by using nicotine replacement therapy to quit smoking, individuals can lower their cancer risk by replacing tobacco with a less harmful source of nicotine. However, it is important to note that dependence on nicotine can still persist. Some individuals may find themselves using nicotine replacement therapy products for longer than intended, effectively transferring their addiction from cigarettes to these products. While this is generally considered less harmful, it may still require management to avoid prolonged dependence. Interestingly, studies indicate that long-term use of nicotine replacement therapy does not significantly affect stress responses or overall health. Users do not experience increased nicotine intake beyond what smokers typically consume. This means that while nicotine addiction can continue, it does not necessarily lead to additional health problems. It is also worth mentioning that long-term nicotine replacement therapy does not guarantee improved quit rates compared to standard treatments. For example, in individuals with chronic obstructive pulmonary disease, long-term nicotine replacement therapy did not lead to higher cessation rates than other methods. However, it remains a valuable option for those looking to reduce harm. If someone needs to use nicotine replacement therapy for an extended period, it is best done under the guidance of a healthcare professional. They can help manage dependence and ensure safety. Ultimately, long-term nicotine replacement therapy is a safer alternative to smoking, even if nicotine dependence continues. In summary, the long-term effects of using nicotine replacement therapy are generally safe, with no increased cancer risk or major health issues. However, there is a potential for ongoing nicotine dependence. Using nicotine replacement therapy can be part of a harm reduction strategy in treating tobacco addiction, making it a helpful option for many.